Good afternoon, everybody. My name is Mike Klag. I'm Dean of the school, and I'm here to welcome you to today's symposium on the Syrian Refugee Crisis, Searching for Solutions. And I guess you'd have to be living under a rock for the last month not to know the issues that are going on in the world, and especially as they relate to the sequela of what's happened in Syria. The UN estimates that over the past year, more than 380,000 men, women, and children have fled war and poverty in the Middle East and Africa in search for a better life. These are the kinds of issues that the Center for Public Health and Human Rights and the Center for Refugees and Disaster Response deal with every day. And I'm really very happy that the two centers have come together to host this symposium today. We've seen the pictures, we've seen the crisis in the European response, the tragic stories, and the incredibly high numbers of people who are fleeing to a reception that is not welcoming. There are many deep political forces behind these trends and innumerable competing influences affecting response. But war, refugee flight, and the human suffering that derives from these crises affects the lives of millions of people, just as surely as HIV, cancer, and gun violence do. In public health, it's our responsibility to deal with big problems that affect human health, and this is no difference. It's our responsibility to understand what the factors are, the risk factors that lead to this, the drivers, and what can and should be done. What population-based interventions can be done to rectify the situation? We don't have expertise in ending wars. I mean, the folks who try to do that go to SICE, not here. But what we can do is define the consequences of strategy, of action and inaction, and the sequela of conflict on population health. And based on the evidence that we generate, we can devise solutions, either whether they're policy or harm reduction or others, to end suffering. This is our centennial year here at the Bloomberg School, and we take pride, and I personally take pride in the willingness of our faculty, staff, and students to take on any problem, to go beyond the walls of what some people think are public health, to preserve human life. So that's what we're going to do here today. To begin, Len Rubenstein, senior scientist in the Center for Public Health and Human Rights, will talk about factors driving the refugee crisis, driving civilian death and injuries, healthcare destruction, and share some of the stunning statistics on refugee flight. Following that, Court Robinson, associate professor and from the Center of Refugee and Disaster Response, will highlight the poor conditions and lack of opportunity in the refugee camps, the exodus into Europe, and the need for the world to come together and commit to comprehensive solutions. We are very fortunate and honored to have with us today Ann Richard, Assistant Secretary of State for Population, Refugees, and Migration. Ann is en route to us as we speak from an important meeting in Washington, and when she gets here, she will share with us what she and the Obama administration believe is America's role in helping refugees home and abroad. Finally, we will convene a panel to include student Emily Lyles, faculty members Adam Kushner, and Syria Country Director Mark Ohanian from the International Orthodox Christian Charities here in Baltimore. Along the way, there will be opportunities for audience participation and questions. When you do so, we ask that you use these microphones that are at the side because this is being webcast, and if you don't use a microphone, the audience on the web won't be able to hear your voice. Please join me in welcoming Len Rubenstein to the podium. Thank you.